Welcome to the Dental School Guide podcast, your ultimate destination for all things dentistry. I'm Dr. Tanner Townsend, your guide through the complex world of dental education. Join us as we uncover the secrets of acing dental school admissions, navigating residency programs, and exploring career opportunities. Please share and enjoy. Real quick, just wanted to make all you pre-dental students out there aware of a resource. If you've ever been worried about getting into dental school or are wanting to get into that school of your dreams, then you definitely want to check out a program called Dental School Guide. In the program, we walk you through how to save money, time, and heartache when applying to dental school. There's so much fluff out there when it comes to resources for getting into school, and we are streamlining all of that. With our comprehensive digital course, expert mentorship, and personalized application review services, you'll have everything you need to stand out to admission committees. Take advantage of this amazing resource that will help you increase your chances of getting into dental school. You'll want to check out dentalschoolguide.com. Check it out. Welcome back to the Dental School Guide podcast. I'm your host, Dr. Tanner Townsend, and I am here with Dr. Lindsay Springer, who is one of the clinical directors at ASDOH in Arizona. Dr. Springer, we are so happy to have you on. How are you doing tonight?
I'm doing great, Dr. Townsend. Thank you so much for having me.
So, Dr. Springer, we're going to kind of get into the nitty-gritty a little bit about AT but just so our listeners get to know you a little bit better and what your role is at AT and how you're involved with admissions and things like that and on the clinical team, tell us a little bit more about yourself and your background and how you ended up at AT.
Well, I guess I should start from the beginning. Service has been in my family since I was a kid. So that's just kind of who I am. And I decided that I wanted to be a dentist in middle school.
Wow, you
So
decided
kind of
early.
nurtured, yeah, really early. Nobody in my family's in the healthcare field, so my parents kind of thought I was a little bonkers for that. But yeah, I just kind of nurtured that passion, had some mentors. I went to UCSD, got huge free clinics that serve, the underserved there. So that just kind of kept, nurturing that desire to help people. And then I met the founding dean, Dr. Jack Dillenberg, and he was amazing. And everything he said was amazing about, ASDOH. So it was my number one school, a place that I had to go. So I got in, graduated in 2012. I did the dual degree with a master's in public health with a dental emphasis and got a Navy scholarship. So after I graduated, went and played with the Navy for a little while and went on a few humanitarian missions and did dentistry all over the world and mostly took care of Marines. I separated from the Navy and I had some close mentors that I stayed in contact with from the school. And they called me up and said, "We want you to come teach." I kind of laughed. I said, "I think I'm too young to do that. I don't know if I've had enough experience." And they said, "No, you're exactly what we're looking for. We want some younger faculty to come, and kind of supplement. We've got a lot of digital technology that we're trying to get off the ground, and just kind of looking for some fresh ideas." So um, I took the plunge and decided I'm going to go interview here. And it was everything it was when I was a student. I mean, just a family oriented kind of environment, very friendly, again, service oriented, and just everything that I wanted as a student and even more as a faculty member. So I'm really thankful that I get to be a part of this crew because they are just an amazing group of individuals. I don't think there's any other faculty like them across the country.
Wow, that sounds like quite the journey going from ASDO and then to the Navy and then back. So that's kind of quite the beginning journey to your dental career. That's awesome. So tell us a little bit about your current role at AT Still and then how that's kind of evolved over the time that you've been there.
Sure. Well, originally I just started out as a clinical faculty. So, unlike most of the other traditional dental schools, we've got a real small group of faculty that take care of the clinic. So, we don't have like the traditional restorative department, oral diagnosis department, things like that. We do have specialty clinics, but our mission is really to treat, comprehensively and teach dentists how to be dental students how to be dentists, and then refer to the specialty departments. So for me, I taught on that general dentistry clinic kind of floor for a year, and then I was asked to promote to a comprehensive care unit director. So I oversee third and fourth year dental students and now second year students because we're getting them in the clinic even earlier, which is fun. So I've been doing that position, gosh, almost 6 years. I've been at the university 7 years in October. So it's really fun. But in light of just doing that piece of the puzzle, I also serve as a co-chair for admissions. I've been on the admissions committee for 4 years now. Last year was the first year I served as one of the chairs, and so going into my second year, and it's really been a lot of fun. It's a different way to have an impact, which I really enjoy.
Wow, that's neat that you get to see the clinical side with the third and fourth year students as they're kind of putting pieces of the puzzle together and students that are just starting on that journey as well. So as you kind of alluded to, let's kind of talk a little bit about AT Still as a school. What are some of the things that you feel like highlight and set AT Still apart in terms of like your guys' curriculum from other schools around the country?
Sure. I mean, I would say the number one thing that sets us apart are our external rotations. Our founding dean really, believed in taking care of the underserved population. And so we get to do that within the, clinic walls, but we also get to expand out across the country. And we've got external rotation sites from Alaska all the way to Maine. There's about 70 of them. So we send our students out at the end of their third year. So in the summer of third year, they can go out on their first rotation. They're usually 4 to 5 weeks long. And, going from seeing a couple of patients a day to 6 to 12 patients a day, it's just an astronomical jump in clinical experience. I know there's some schools that do a couple of those, but we do five. And so you're basically out 50% of the time in your fourth year. And the best part for us is our students are getting the volume that they need, the mentorship that's one-on-one with their preceptors, but we're also reaching, our mission of taking care of those in need. And there's just really a huge access to care problem in this country. So it's nice to be able to have somewhat of an impact and help those safety net clinics.
That's incredible. So how did you guys go about obtaining like those connections with 70 different clinics across the country? That's a lot.
Yeah, it's a lot of networking and partnerships. I mean, it's a huge benefit for the site, right? Because they're going to get a student that comes in, and their volume goes up as well. So it's kind of a symbiotic relationship, if you will.
Yeah.
As we've grown in our alumni, we've got quite a few alumni that go back and serve in these clinics. So they're willing to be preceptors. Everything has to meet a CODA standard in terms of evaluation and working with students. So, they try really closely to make sure that they're on point with that. But it's just continuing to nurture those relationships. And unfortunately, the need in this country continues to grow for oral health. So we'd like to see that get better, but in one respect, it does help us, continue to maintain and have the ability to have all these sites.
Oh, that's awesome. Actually, one of your guys' sites is actually in my town here. Uh,
Great.
yeah. So when I was speaking with Razzle on one of the podcasts that we did with her, and she was like, "Oh yeah, that site, Riverstone Health, is in Billings, Montana, is the one that we have as one of our options." So I just thought that was kind of
Yeah,
cool.
that's a popular site.
Yeah. So, I mean, we actually work closely at our clinic with them actually. We do all the dentures for that site, for that office. So, whenever they have denture stuff, we're a denture and implant office, my office is in particular, and so they send all their stuff to us, which is kind of fun.
Very cool.
Yeah. So, going back to the education side of it, what are some things that you guys really seem like you do a good job of making sure that students are really clinically ready upon graduation? How do you guys help support students, like whether they're wanting to pursue an AGD, go to private practice, go to a specialty program? How does the school help prep them for that future career endeavor?
Sure. Well, I would say that starts with our mentorship program. So when you enter our school, you're paired up with, if you're a D1 entering in, you're paired up with a D2, D3, and D4. So that kind of gives you a leg up on like how to integrate into clinic, excuse me, how to get integrated into clinic and how to, kind of navigate the school without even having to be in the clinic yet. So you already have that relationship there. Our faculty, most of them, the clinical faculty is teaching the didactic courses and simulation courses. So you're establishing a relationship with the faculty early on. So we're really good at faculty mentorship with students if they show an interest, or a desire to, be in periodontics or endodontics. We've got that covered for them. And then outside of that, since we don't have any true residency programs outside of our AGD and our orthodontic department, there's lots of opportunity to do, a large case volume in, say, endodontics versus other schools where that tends to be, farmed out to residents. That's not the case for us. So you've got students that really can speak to the fact that they like, orthodontics. And I've done, 15 cases as a third year. And I mean, it's huge. So I think those are two things that really kind of help our applicants shine. They just get a lot more out of their experience at ASDOH clinically, which kind of shows the residency program how prepared they are.
That's awesome. Yeah. Not many programs across the country even let you touch ortho, let alone some molar endo and things like that, that's a awesome thing that you guys are able to do at AT Still. So talk to me a little bit as well about this master's program that you said you did a master's program in public health in conjunction with your degree. Not every school in the country offers like a dual degree program like that. AT Still is one of the few that does that. Walk us through how that works if students are interested in that, if they were to go to AT Still, and how that works with their DDS degree.
Sure. Well, again, part of our mission is we want to attract applicants that want to serve, right? Some sort of service within their community to make things better and to help people. So we offer everybody a chance to get that dual degree, but everybody will graduate with a public health certificate.
Oh,
So
wow.
they've got enough foundational knowledge in public health, from that certificate. And then those that want to go on to the dual degree and get a master's, 7 additional courses. It's very reasonable in cost. There's a practicum at the end that students have to complete. A lot of them work in groups together to do that. It's all online based. And it's really just, it's a great opportunity. And I'm glad that we have, about 25% or so that take advantage of that every year.
Wow. So every student gets a certificate in public health. Are there a number of public health courses that they're taking during their first and second year in particular to be able to get that certificate? How does that go about?
Yeah, they're integrated into the curriculum. I think I want to say it's 10 courses, but don't quote me on that. Yeah.
That's a lot. I think I had like one class on public health or like something like that, or we like touch on it here or there in a lecture or two in a class. So that's really neat. Anything else that you feel like kind of helps ASDOH shine out, or AT Still, excuse me, or ASDOH kind of shine in its own right that we haven't already kind of touched on?
So one other thing that we're really known for is early clinical experience. So our D1 students get into the clinic to assist our D3s and D4s about week 5, which is super early, but we, really want to get them involved. We want them to start utilizing the skill sets that we're teaching, how to take blood pressure on patients, how to do a medical history, how to call a patient from the waiting room, note notes, what does our computer software system look like, where are the chairs at and the supplies. So we really try to get students in early. The other nice thing is it kind of breaks up the monotony and any kind of burnout that they could have in their first year, because didactic courses are pretty heavy. So it kind of gives them a little break from that. Our second years, they're spending time in the sim clinic, but by fall, so actually this coming up September, our D2s are going to see their first patients. So second year, you got your first patient, which is really exciting.
Are they just doing cleanings on those patients, or what are they getting the opportunity to do during that second year?
Yeah, that's a great question. So the first patients are going to be prophy patients, and then we'll evolve them into an exam, periodic exams and comprehensive exams, and they'll start building their patient family pool and begin treating those patients, simple operative procedures and stuff, probably by the new year. And then they'll be rotating into our specialty clinics, getting experience with that as, a surgical assistant. I mean, it's just it's really neat to see. That wasn't like that when I was a second year in dental school, so I feel like the transition into clinic rather than it being a big hard stop, from sim to clinic is a lot easier because it's just a soft rollout over a long period of time.
How have you seen like the clinical readiness of those D2s? Do you feel like by the time they get there that of course there's going to be some nerves and some things like that that they might have, but do you feel like they're pretty clinically ready, especially as they transition to D3s at that point?
Yeah. Yeah, I mean, we do a really good job in our simulation clinic. We utilize a lot of technology to kind of get hands-on experience in that clinic, where it feels real. I would say most of them are just so excited. I mean, a lot of them have on their self-study days, they'll be in the clinic with us, just trying to get any kind of additional assisting. Sometimes they wanna come in and, practice on each other, and we have to tell them, "Sorry, we don't have any chairs,"
Yeah.
because we're treating patients, but they're eager to get in, and they'll try to stay late and, in the evening too, and, I mean, it's fun to watch the excitement of these students see their first patients.
That's really cool. So you had also mentioned as we were discussing earlier that the technology is something that AT still is really trying to focus on. What are some of the different technology things that AT still is trying to implement into their curriculum that are going to set your guys' students above and beyond?
Sure. I mean, digital is huge, right? It's
Mhm.
taken over dentistry and evolving really rapidly, and I think in the educational environment, it's difficult, right? Because it's hard to implement new technologies. The cost is there. Where do you fit it into the curriculum? How do you train the faculty, especially if you've got faculty that are a little bit more older and not as willing to learn the technology? So for us, I mean, we're a small group of faculty, like I mentioned, and we're sprinkled in with veterans as well as younger faculty members. And in everybody, really, the turning point I think for us was COVID. Everybody jumped on digital technology because we all kind of had to, right? Whether
Yeah.
it was Zoom or, we started doing way more in-house milled crowns things, and I think it just kind of motivated everybody. So we've really tried hard to implement those technologies. We do some digital dentures, a lot of 3D printing. We had milling units upstairs, we have milling units downstairs. That starts in our sim lab. Students get a lot of experience with scanning. We want them to be proficient when they come down to the clinic because it takes time to do, an in-house milled crown. Lose time, then we lose an opportunity. So we try to introduce that really early. It's at the end of their first year, and they practice all throughout their second year, and they're ready to go by the time they do those crowns in their third year. So it's super fun. ExoCAD technology up at Cross and Ontario, and you name it, we're working with it.
Wow, that's really cool. I think, like you said, that's kind of the way of the future. And I think COVID was really truly that turning point where it's like, okay, we all got to adapt it and adopt this in some way, shape, or form. So well, let's kind of put on your admissions hat for a minute, and then we'll kind of switch gears and talk about that. Um, just kind of just starting really broad, walk us through what does that admissions process look like at AT still? From the point of like, hey, we're starting to receive applications to we're sending out interview invites and so on.
Sure. Well, everything goes through a DIA first, right? That primary application. And if you meet our prerequisites, then you'll get a secondary application. From there, you're going to go through our first review process with our admissions team. It's the ATSU admissions team that looks at that. And again, they're just making sure that you meet the minimum requirements. And they'll pass you on to a faculty review. We've got a committee of 9 that review all these files. They're at first come, first serve. As they roll in, we're looking at them. So we're not, cherry picking things out. So if you get your application in early, that definitely will help you out because there's a lot of them. I think last year we had just under 3,000, and we interviewed a little over 500. So and I think I've seen this on your guys' website. The odds of getting in are not good, right? So trying to understand what a school is looking for, I think, is important. So for us, when we're doing that first line faculty review, we really are looking for people that are going to meet our mission, right? Do you have a heart for service? Is there an interest in dentistry? Is there an interest in us? You know, why are you applying to our school? And we really want to make sure that, we're a good fit for the applicant too, because it's a big investment. It's a lot of money. We're a private school. We're definitely worth the money, but we're still, we're an expense. So making sure that we're both a good fit for each other is a priority of ours.
Yeah, I think that's something that students often forget is as much as the school is trying to see if you're a good fit for the school, you're also trying to see if you're a good fit for within the school's culture. So I think remembering that is a key aspect. As we kind of go back, let's kind of start at the beginning of that process that we just walked through there. As you guys initially screen, as applications are starting to roll in the beginning of June and through July and August, and you're going through and checking those prerequisites for students, you're checking obviously for coursework and making sure that the coursework is there. Are there certain cutoffs and things like that that need to be met in order to be considered in that faculty review, in terms of DAT and GPA score? Or is it like, hey, we're going to kind of look at this more holistically and then pass it to faculty?
I would say for the DAT, that's kind of a holistic look. We don't have a minimum requirement on that, but we do have, a competitive number. So our competitive DAT would probably be a 17. I think our average score is a 20.
Mhm.
So that kind of gives you an idea of where we're at on that. And in terms of GPA, a minimum is a 2.75. But again, I mean, like last year, our class average was a 3.5. So I'd say anything probably below a 3.0 is probably not competitive. So those are definitely things that the first line is looking at the very bare minimum. Faculty review, we're kind of looking organically at the application as a whole. And really, if they've made that first line mark, with scores, unless there's something like a huge outlier, we're really not looking at that anymore. We're reading personal statements and looking at letters of recommendation, service hours, and what kind of extracurricular activities is the applicant participating in. Those are things that are of value to us.
So as you guys are looking at from the faculty perspective, let's talk about the personal statement first. What do you typically look for, Dr. Springer, in a personal statement? What do you think makes up the good components of a personal statement in your eyes?
I mean, I read a lot of personal statements and I do enjoy a good story. But unfortunately, I think as the longer I sit in this position, the more I read, some of them I'm not sure are real anymore. Right? We've got a lot of AI technology out there. And sometimes you read stuff and you're like, wow, this personal statement doesn't match the secondary application questions. So for me, I'm looking for honesty. Right? It doesn't have to be anything big and flashy. Tell me why you're interested in dentistry. Maybe how did you come across this path? If you've got something unique, I'd love to hear it, but it doesn't have to be this big, extravagant personal statement. I just really kind of want to get to the truth of why are you applying and what is it about dentistry that you think you love?
So you like to see what their passion is. I agree with you. I think a lot of these, as I've read a lot of them, I'm like, holy cow, this is quite the experience. Like, maybe I'm just the loser. I don't know. I lived a pretty normal life, I guess. But yeah, I think trying to just convey what their true passion is for dentistry. It How do you feel about applicants kind of expressing what the characteristics that they've learned over their their lifetime and that they've developed as they're starting to pursue dentistry? Do you like to see that? Do you not like to see that?
Yeah, I definitely like to see that. I mean, especially somebody who you can tell they've had a lot of interpersonal growth, right? From maybe the time that they were in high school till, they finish college. I think sometimes, there's things in applications that applicants don't want to talk about. We're always going to ask you about that.
So
So
just
if
talk
you
about
have
it.
a way to, yeah, if you have a way to incorporate it in your personal statement that can spin it and make it a positive, I would always encourage that because then you're at least addressing it up front versus it being the elephant in the room. Because at least for our team, I mean, we're going to ask you if you've got, a low score or you had to withdraw from a class or you failed something. I mean, we're going to want to know, kind of what happened and how did you grow from that? I mean, it's not necessarily a black mark for us, otherwise they wouldn't make it to the interview. But I think just again, honesty.
Yeah, I think that's the overarching thing of just being yourself and being honest. Don't try to hide anything. As we talk a little bit about the other essays that are in the application, like you got the COVID essay and the manual dexterity, and the different experiences an applicants have. What are some things that you are kind of looking for? Let's talk about experiences first. When you're looking for experiences in terms of service and extracurriculars and volunteering, what aspect do you guys weigh as more important? Is it the volunteering? Is it the manual dexterity experiences? What
I mean, I wouldn't say we put a lot of weight on the manual dexterity question. I mean, it's nice to read because sometimes you hear some really interesting things, right? And it makes for good interview questions sometimes when you're kind of getting to know somebody because that's really how our interviews are. But I would say service. We want to know what kind of service history you have. I don't really care if it's mental based. Just I want to know that you have a passion to help others. Our team is looking for that. Extracurricular activities, I mean, obviously athletics and arts that are part of the school versus intramurals and club-based kind of extracurriculars, those just don't have as much weight. Um, I would say philanthropy is good, but again, I'd rather see somebody, that's doing true service work for the underserved rather than, donation based or fundraising based. It just doesn't have as much weight for us because we want to know that's in your heart.
Yeah, I think that's a very good point. So how do you guys view shadowing? For example, every school that I've talked to kind of views shadowing in a little bit of a different light. I have my own opinions on shadowing. What are your guys' opinions on shadowing as you're seeing that roll across your table with applications?
I don't see this as much anymore, but we definitely do not count virtual shadowing. That just is not, doesn't help us because we're not really sure what you're seeing at that point. If you're just watching something on Zoom and you can't really see what's going on, I mean, are you really getting a feel for things? I think anybody that's actively chairside assisting is great because you're interacting with the patient, you're interacting with the doctor and the staff, you're interacting with supplies and materials and procedures. So we definitely value that. I like to see a wide breadth of shadowing experiences versus somebody who's just been to one office. It kind of shows that there is some interest and you've been investigating, right? Because again, it's a giant investment that we're making and the applicant is making. So we want to make sure that you really, are going to be somebody who's going to stick this career out for, 25 or 30 years versus somebody who's just going in for the wrong reasons and maybe burns out real quickly.
Hmm, That's a very good point. Now, with your every school pretty much has some supplemental questions that they ask, or most do at least. How do you guys weigh those supplemental questions in terms of like weight when you guys are reading those versus like the personal statement and other aspects of the application as a
Yeah, so we score our file review. So like the faculty review that's looking at things. So that's a piece of the score. I mean, it's a 10, point scale. So it's got some weight, but it's not going to make or break, whether or not the person goes in for an interview. I mean, it's a piece of the puzzle. I mean, if you really had something crazy in there, maybe we would say no, thank you, but most of the applications I've seen that have poor secondary, responses usually aren't a good overall application. The personal statement's not good. All their service work isn't there. So there's not, I wouldn't say we put a heavy weight on it, but we ask the questions because we want to know the answers. Why do you want to come to Arizona and how are you prepared to handle our curriculum?
that's a very good point. Now, as we kind of go, you said you guys have a score and you'll score those applicants and kind of judge them if they're ready, I would assume, versus not ready. And then those ready ones will kind of go out for interviews. Is that correct?
Yes.
So as you are extending those interviews and we get to interview day, what does an interview look like for pre-dental student that comes to AT still?
Sure. Well, it's a half a day, which is somewhat long, I think, compared to other schools, so at least from what I've been hearing for the last couple of years from applicants. But you come in, we do a welcome. You'll hear from Scott Edwards. He's great. He takes care of all of our applicants throughout the year and provides guidance and counseling. So it's kind of nice when applicants can meet him face to face. He's always there. There's usually a welcome from the dean or one of the co-chairs, and we kind of talk about the school. We do an icebreaker just to try to ward off any nerves. And we always ask people to, give us a fun fact. We introduce the faculty interviewers that day. So for our interview, there's two faculty per applicant. So there's usually six people in the room and they get to say fun facts. And we really tell people, in that welcome that, we're a family here and we want to get to know you and see if you want to be a part of our family and if we want you to be a part of our family. And so it's kind of like settles those nerves. You can see people relax a little bit. They're not so uptight in their suits and, slacks. Um, and it's a nice way to kind of start that whole process. And from there, the interview is divided up into different sections, so everybody will go do a group activity first. There's usually a question and six candidates will, I guess it's five now, we moved it down to five will work together to answer a question and do a short presentation. And then from there the schedule is divided up. You may be going into your interview, it could be MMIs, there's a tour of the clinic. We try on white coats because at our school we give a white coat that first Friday, the first week that you're in school. So we want to order that in advance. So we've got your size. And then there's an admissions presentation on the school as well. So it's a long morning, but hopefully, and we get a lot of really good feedback that applicants have really enjoyed our admissions process and found that we're friendly. We're not trying to be scary or make anybody feel uncomfortable. We just want to get to know you.
So, in terms of questions that you guys typically ask, everyone's like, "What questions are you guys going to ask? What was it going to be like?" And I think people just get so overhyped, and I think the answer really comes down to just be yourself. That's what they really want to see, is that you're a normal person and that you're someone that they is relatable. But from your guys' perspective, from interviewers, what are you guys trying to find out? What are some of the common questions that you guys feel like you repeatedly ask candidates when you're in those interviews?
I mean, the two big ones, we're always going to ask you why you want to be a dentist.
Mhm.
I mean, that's just like a standard, right?
Yeah.
So definitely applicants should be prepared to answer that question. And we're always going to ask you, why do you want to come to ASDOH? What is it about us? So, do your homework and investigate who we are, um, because we'll ask that several different ways. And if you're if you're not, community minded, and we ask you about that, I mean, it's all over our website. There's lots of information out there. We've got social media pages, Facebook, Instagram. I know there's a bunch of information on studentdoctors.net. So it's like you've got all this information about us. Make sure you know who we are and why, why you want to come to our school. I would say those are the two, and those are always going to get asked. They're the basics. And then I think for most interviewers, again, we want to know that this person is going to meet our mission, right? That they've got heart for service. So that doesn't mean that you have to be a community health dentist or we're expecting that you're working for free for people, but we want to know that you're going to have some sort of an impact on the community beyond dental school. So, we're looking for your service, experiences, and we're going to ask you about those. I usually, for myself, I tailor my questions towards whatever service they've had. So I think, being able to, again, be yourself and share your experiences and be honest, I mean, that wins overall every single time.
Yeah, it truly does. Now, one of the unique aspects I think you guys have with your interview is that 5 student panel where like you have like a question and 5 students kind of answer it. Tell us a little bit about that and how that evolved and what you guys are, you don't have to give away your secrets necessarily here, but what are you guys hoping to gain from students having that experience?
I'm glad you brought that up because I forgot to mention that. And we give you lunch too when you interview with us, with the students. But yeah, so we try to have students from every single class that are there to have lunch. honestly, the admissions team doesn't gain any feedback from them. So we're very transparent about that. I tell applicants all the time, they're there for you. We want you to get to know us. We want to be very open about who we are. We want to show you that our students are happy to be at our school. And they will be very, brutally honest with them, from where they're living and what things cost and what the culture is like. So that's really there for the applicant. It has nothing to do with the admissions team.
That's great. And the multiple mini interviews, tell us a little bit about those in a little bit more detail, if you don't mind.
Sure, yeah. So the MMIs, they are usually a standard question that's asked. There's three of them, and we just tell applicants right in our welcome, just be yourself, answer the question. The person's going to do some role playing with you. There might be some things that may catch you off guard, and just use your communication skills and you should be just fine.
I think that's great. I think students, like, once again, they just get so hyped up about that. And it's like, just relax. It's going to be okay. Just answer the question. That's the biggest thing. Just answer the question straightforward. So, um, all right, let's go to the next kind of thing. So, as students kind of get their interviews or they're waiting to hear from schools, a lot of them just, there's that waiting period that's just so hard on students. They get so anxious.
People.
Yeah, it is so painful, and I feel for them so bad because I remember how that was where you just, like, sometimes you go weeks or months without hearing anything. What advice do you have for students during that period of time of just kind of when they're waiting?
Sure. Well, I would say if it's before December 15th, you just got to wait
Yeah.
because we have to wait too. We can't release any acceptance offers until that date. If it's after December 15th and you haven't heard from us, you definitely can reach out. I mean, we are more than willing to talk with applicants and kind of, give them feedback if we can. If we haven't interviewed you yet, that can be a little bit of a challenge. But if we've interviewed you, we can definitely give feedback because all of our interviewers provide, comments. We usually let those that are not in, we let them know right away. They're a do not accept. If there's somebody that's on a wait list, they could find that out. Let's say, but once you find that information out, don't keep calling, don't keep emailing to the point where it's annoying, right? Because we're dealing with thousands of applicants. So we're happy to make contact and let you know where you are, but there's really not a way to be persistent and have us move you somewhere else on the list.
I think that's a good point. And so how that kind of leads to this next question. What is your opinion of letters of intent? I have my own thoughts on this. I know deans have their own opinions on it and it varies a little bit, but how does AT still kind of view letters of intent? This wasn't even a thing when I applied. This whole letter of intent thing.
Yeah, I mean, that was not a thing when I applied either. I mean, our school will look at them,
Yeah.
but it's really not going to have an impact for us.
Yeah, and I think that's kind of the trend I'm seeing as we interview these different schools is that the letter of intent, I don't know if it would transferred over from the medical side or what, but it doesn't seem to have as big of an impact as I think students think it does. So,
Yeah, and I think the other piece is sometimes applicants are thinking that that's going to like the interviewers or the admissions committee. If you write us a letter of intent, it's really staying with the first line team. It's not really getting as far as they think it's getting.
yeah. Now, this was a question that I've got for you because it was posed to me by a pre-dental student. Um, how do you guys feel like you view when applicants or interviewers reach back out to you and say, "Hey, thank you for the interview"? How is that received by most faculty when they send either like a thank you card or an email saying thank you? How does that viewed by the interview team?
Sure. I mean, it's for us, we request applicants put that through our admissions departments. It doesn't always go that way, right? You can Google and find anybody's email address. I get emails all the time from applicants. So I read them. And I think most of our faculty that are interviewing do read them, but we don't respond back. And that doesn't mean that's a negative. It's just we don't want to have any kind of bias or lead you in any kind of way. So we typically read and then delete. And that's about it for us on emails.
I think that's a fair way to handle it. So as you guys are going through that selection process, walk us through as you guys are sitting in a committee of 9, how that selection process goes. as you guys are deciding who's going to be admitted in that future class?
So everything is based on a score. So your MMIs score, your GPA, your DAT, your interview, your group activities lumped in with that. Oh, and one thing we forgot to talk about, Kira. We do Kira Talent.
Yeah, talk to us about
That
Kira.
has a little bit of a weight. Yeah, so we use Kira as a pre-admissions kind of interview process. So we ask 5 questions. It's asynchronous. Faculty really like it, and actually, from our reviews from our interviewees, they really like it too. So we decided to keep it this year. Actually, one of our medical schools is going to utilize Kira because they've seen our success with it. So, but that has a weight as well, and we weigh pretty heavy on the interview because it's person to person feedback. So all of our top recruits, we will send invites out to all of them first. Usually December 15th, we send an email. A couple years back, we were calling everybody, but everybody wants to get that notice like at 12:01.
Yeah, it's really
So we do that. Yeah. I mean, we want to be, we're evolving with technology and times as well. So we want to make sure that we want the applicant to know if we've accepted you, we want you to know right away that you're the one for us, and we don't want you finding out at the end of the day on December 15th. So you'll find out right away from ASDOH. And then from there, we all have to wait, right? We wait about a month to hear back. Applicants that are accepted that first round, they've got 30 days to decide. So now it's our turn to wait at that point. And then based on who has came back and said, yes, I want to, take the acceptance, or no, I'm declining. And we kind of work off of our wait list from there, and it's just trickles down to whoever's those next top scores are.
You guys continue to do interviews into January, February, and March as well, or do you pretty much solely work off the wait list from that point?
No, we interview until about early February.
Okay.
If there was a need to interview beyond that, we would, but typically we're working off a pretty big wait list.
That's understandable. Now, how do you guys view applicants that are submitting later in the cycle? Let's say they took the DAT, they didn't score what they wanted to, and they're like, shoot, I have to wait 90 days now to take the DAT again, and that's putting me into September, October. Every school has a different way that they kind of view that. How does ASDOH view that from your guys' perspective?
Okay, I got 2 answers for that. One, because we're rolling admissions, right? So it's important to apply early. So if you have a not so great DAT score, let's say it's mediocre, put your application in. If you're missing letters of rec, put your application in, because it takes ADSAS, a while to process the application, 6 to 8 weeks, depending on where you're at in the cycle. So if you could get all those other things rolling again while you're waiting just for that first initial primary process. The second piece to that is, I would say, if the score is too low, let's say you're 14 on the DAT. I mean, that's not going to be a competitive score. So that might be a reason to wait, or it may even be a reason to apply the next year if you're too late in the cycle. Because for us, like I said, we had almost 3,000 applicants last year. If you're applying in November, December, we're probably not going to get an interview spot because we're going to be full by that time.
Yeah. No, I think that's some excellent pieces of advice for those students that are in that situation. Any final pieces of advice that you have for pre-dental students that are looking to apply this cycle or in a future cycle?
We've hit on it so much. Just be yourself, right? And if you don't get in the first time, and this is really your goal and your dream, stay persistent and determined. If you have to apply again, in that gap year that you're taking, do something that's going to make your application more competitive. I know our team always loves seeing post-bac courses or even programs that are completed that elevate GPA. Those are good things for us because we add those into your cumulative GPA. We love to see service work, people that go out on, missions across the country to globally. We love seeing that kind of stuff. Somebody that's spending their time wisely, trying to, better themselves is always a positive for us.
Well, that was excellent final departing words of advice, Dr. Springer. So that is all we've got for today for the Dental School Guide podcast. Dr. Springer, I just wanted to thank you one final time. Thanks so much for coming on the episode. We've really enjoyed having you on the show.
Dr. Townsend, thank you so much for inviting us. It's been fun.
Well, thank you, and we will talk to you all next time. That's all for today's episode of the Dental School Guide podcast. We hope you've gained valuable insights and inspiration to fuel your journey into dentistry. Don't forget to subscribe to our podcast for more expert advice, inside tips, and engaging discussions. If you enjoyed today's episode, please leave us a review. It would mean the world to us. Until next time, keep smiling, keep striving, and remember, your dental dreams are closer than you think. Thanks for tuning in to the Dental School Guide podcast.